Can you name them?
Patients,
Family members,
healthcare providers,
staff. Because not every staff member is a healthcare provider, staff. By this now you start to widen the scope of the service. All of us, every single thing in the hospital is to support, built around the patient. From X-ray to cafeteria to food service, everything without, if the patient is not there, there is no reason for all of us to be here. So every single thing, that's the primary reason why we are here. Sometimes the patient, the actual patient is not the patient who's seeking healthcare. The actual patient is the family member, especially in end-of-life cases. That the patient is no longer communicative. If you've been with a patient who's dying towards the end of life, they don't communicate. Maybe they are sedated, under the influence of opioids, and gone. So who's communicating? Who's the actual patient? Is the family member who's going through the hard time of dealing with this anticipatory grief, or the patient has been for 2 years in a coma, that delayed grief. So there are levels of grief that there is. So those are the actual people that we need to help and be with. And then that palliative care provider or that cancer care specialist who go in every single day handing out difficult news to the family members. And we need to care for their well-being as well. If we don't, then there is a barrier to providing this care. Believe me, it's very hard to be an end-of-life specialist. Sometimes I dread the fact that I have to get up in the morning to go and be with the patients. When I'm on call at the hospital, an average of 7 people will lose their life in the course of 24 hours. And they don't die between 8 and 5. Anytime, day or night. You want to rest at 2 in the morning and the call comes in and there are family members. And you go and be with them. Then you leave that room and you go to the labor and delivery, and there is a happy family just received the news and the delivery of a healthy baby. How you as a provider will be able to switch that click between a death in one room and celebration on the other. And they look at you and, oh, you're so tired, what happened? Well, the patient next door died. Would you say that? You don't. Common sense tells you that you don't. So what do you need to do in order to empty that baggage that you have? And we have a lot of baggage. In our faith, the Prophet said, be in this life as what? A traveler. As a traveler. That means don't go into this room with heavy dose of agenda. I want to make it for everyone. I want to have everyone practice and do the 5 daily prayers and do the shahada at the end of life. And no. Reason, بالعقل, with wisdom. Meet them where they are at their level. They are fine where they are. They are fine where they are. And it's not our responsibility to offer hidayah, guidance. We invite. And we ask permission even before we speak. Okay?
Excuse me?
Yes,
Sorry,
please.
sir. My name is Dr. Aisha. I'm an ophthalmologist. I'm currently doing subspecialty training in pediatric ophthalmology. So I work with premature babies a lot, and so we deal with a lot of families who are having anticipated grief as well in terms of children. And I understand when you say we have a lot of baggage, and I don't know, maybe it's my personality, but I get quite attached to my patients, all these babies, small babies born 500 grammars, 600 grammars, and when death happened at very early stage of life, I just don't know what to tell the parents. I just don't know how to console them when I'm crying myself. And I just lost one twin yesterday. One twin survived and the other twin did not yesterday, and it just shook me throughout the day. And it's not even my baby, but I really need an input. How do we do this spiritual care to parents? Because like you said, it's family members who need the care more than the patient, because the patients are just not just babies, but they're babies. So how do I provide this to the family?
Thank you for the question.
Thank you.
Are you willing to take it a notch deeper? Are you willing to talk about it more?
Without crying?
I'm the biggest crying baby. Are you willing?
Yeah.
Do you have children of your own?
Yeah, I have 4, alhamdulillah. And I have 3 premature babies myself.
What are their ages?
12, 11, 9, and 2.
And when you go into that room, do you see your
It's
children?
11 o'clock.
Do you see your children in that room?
I tend to treat my patients as if they are my children.
Do you see your children in that bed laying down?
Not to that extent, I suppose.
To a certain degree.
To a certain degree, yes.
We worry about our own when they get sick. Yeah. It's the hardest part to separate ourselves from our patients. And the biggest disservice to ourselves, if that urge to cry, we inhibit that. And we be cold in that room. And we rush to do things because we want to get out of that room because we're not comfortable. If crying makes sense, by all means, do cry with the patient. Up to a degree. If your patient starts to comfort you, you know you're in trouble. You know that you need to excuse yourself, go to the restroom, wash your face, do what you need to do, then come back. Anything short of that is okay. Anything short of that is okay. That's the boundary level. When you become the one in need, that's the boundaries. Aside from that, it's open book.
Sorry, won't that make the parents uncomfortable? Like I'm supposed to be the rock for them to rely on. Like I'm supposed to give them strength, and yet I'm crying with them.
I was invited to go to the pediatric. At Stanford we have 2 hospitals, adult and children. And there is a barrier in between. Stanford adult is tiled floor, the children is carpeted. So I'm invited to go to children, Lucille Hospital, Lucille Packard. As I'm approaching that carpet, I'm taking 1 step forward and 2 back. I don't want to be there. Honestly, I don't want to be there. And but I pressured myself. I went there and the nurse said, say a prayer. The child just passed. Just say a prayer. And I'm looking at her. What a punch there. I looked at the family, I said, does it make sense for me to say a prayer? They said no. It's all about what we bring expectations of us. The family did not want a prayer. The family just lost a baby. And we are trained to separate ourselves from our patients. But you know what? Sometimes, and that's the judgment call, the family wants to feel that you are part of them, not the inferior part of them. 17 years ago, my own daughter died in my hand as a baby. So I dread the fact that I go into the children's hospital and got the courage one time when I met with a patient that has similar diagnosis. Give myself the permission to say, which I don't say it lightly, I know how you feel. Sometimes we say that word, but literally we don't understand it, because unless you are a patient, went through the same, you will never understand. You will just attempt. So be humble about it and be careful with the choice of words. I said, I know how you feel. She said, what do you mean? I said, I have exactly the same case as you are. And the immediate response was, tell me what happened with you. I said, I would love to share, but it's really about you now. You see how you open up? We cried together, but at the end, it's like you pull back. It's really about you now. I can share with you from an experience what might be happening with you. Might. Because I don't know. And I was able, alhamdulillah, to be with that patient and share and comfort. Her biggest fear was the patient had twins. One of them was fetal demise, and the second one was in the NICU, the neonatal ICU. The biggest fear was, I don't want my father to see a dead baby. The family is on the way to the hospital, and the baby is still on her chest. And the promise that we say, would you trust me with your baby? I will hold the baby for you. The family will visit with you, and I'll be right next to you. Once they leave, I'll hand you back your baby. So I held my baby twice. That's what we do. We project, we relive situations, and we allow our patients to impact us. And that's what we say, it's a journey. So we look at the gifts that Allah subhanahu wa ta'ala give us from those people who will challenge the core of us, the depth of us. They challenge us, and they make us a different person every single day. And that's how we become better at what we do. So there is no expert in this field. All of you are expert in the level of openness that you provide, energy that you put, and love that you give. Remember the hadith. لا يؤمن أحدكم. You shall not attain faith until you love for your brother and sister and what you love for yourself. Those are the tradition and the verses that we grew up with, and we read, we start to reflect on them differently in that context.